Good evening to everyone. I'm Dr. Omkar Swami on behalf of MCure Pharmaceuticals Limited. Welcome you all in this scientific deliberation by Professor Dr. M.B. Aggarwal sir. Today, we are very fortunate to have a sir for taking us through on the diagnosis of anemia, a 360 degrees overview. It gives me an immense pleasure and privilege to welcome and introduce Professor Dr. M.B. Aggarwal sir for this elite gathering today evening. We have already noticed that more than 1,000 registrations are there and almost a few hundred people across the country are visiting to this program. Sir has been a head of Department of Hematology at Bombay Hospital Institute of Medical Sciences, Mumbai. Sir is working as a senior consultant hematologist at Lilavati Hospital, Bridge Candy Hospital, Mumbai. Sir has been a president of Mumbai Hematology Group, Indian Society of Hematology and Transfusion Medicine. Sir has been a founder, member, and secretary for the Thalassemia and Sickle Cell Society of Mumbai, and organizing secretary of annual National CME in Hematology and Hemato-Oncology. Sir has a teaching experience more than 3 decades for undergraduates and postgraduate level. Sir has been a recipient of several fellowships, prestigious fellowships, orations, lectureships, awards at various levels from school, college, university, and various professional societies as well. Sir has been invited speaker for conducting workshop at various prestigious institutes in India and outside India in France, Germany, UK, Cyprus, Italy, Thailand, Malaysia, Singapore, Cambodia, Mauritius, Bangladesh, and Sri Lanka. Sir has been an author for more than 130 articles in various national and international journals and has been an author for more than 7 books. Sir is an emeritus editor for Indian Journal of Hematology, honorary editor for Indian Journal of Hematology, and editor for the newsletters of Thalassemia and Sickle Cell Society of Bombay. Thank you very much, sir, accepting our invitations and joining this lecture series today and also on 22nd of this month, where we will be discussing about the diagnosis and management of anemia. So I will not take much time and I would like to hand over this session to Professor Dr. M.B. Aggarwal, sir. Over to you, sir. Thank you very much.
Thank you, Dr. Omkar Swami. I'll just share my screen. Right. So, good evening, friends. Today I'm supposed to speak to you on diagnosis of anemia, 360-degree overview. And I thank MCure for putting us together for this particular webinar this evening. In fact, this is the first part of a series of webinars that we are going to have. Today is on diagnosis. On the next Friday, we will have the treatment. Hematology is a science of blood, and the blood is extremely colorful. Today, we are just going to talk about one color, and the deficiency of that color is anemia. And that's what the red cells contain, the hemoglobin. Those of you who have read Mahabharata, and I think there is hardly any Indian who must not have read Mahabharata or seen Mahabharata or heard about this wonderful epic. Pandavas were sons of the king Pandu. And Pandu was called Pandu because he was pale, he was anemic. Anemia gives a lot of symptoms, and they are listed here. I have no intention to go over this because that is very preliminary medicine. When you want to diagnose anemia, see Mahabharata or heard. This pallor may be visible in the conjunctiva. It may be in the tongue, as on the left side, and the right side is the tongue after the treatment. It could be in the hands, again, left before the treatment, right after the treatment. It could be sole of the feet. And it also gives rise to angular chelosis, as you see that the cracking of the angles of the mouth where the lips meet. Anemias are of various types. On the top, you see when there is a deficiency of the building blocks. You require iron, B12, and folic acid for the formation of hemoglobin. And if there's a deficiency of one or more of them, you're anemic. Then, of course, the bone marrow can go on strike, and you may have decreased production of the red cells. And there's a host of conditions over there. You may lose blood, like a woman due to menorrhagia, or a man or woman due to hemorrhoids. And lastly, there could be destruction of the blood, what we call hemolytic anemias. As we just have about less than an hour to discuss, I am going to concentrate on only one entity, that is iron deficiency anemia. Maxwell Winthrop, the father of hematology, Johns Hopkins Institute, US, 1901 to 1986. And I had the privilege of rubbing shoulder with him in some of the international conferences. And of course, he's no more with us for the last 35 years. We grew up as hematologists reading what is called Winthrop's textbook of clinical hematology. And what you see on the right side is Blood Pure and Eloquent, which gives history of hematology. This gentleman, under the microscope, could see that the red cells could be small, normal size, or large in size. And he described the anemia to be microcytic, small red cells, normocytic, normal size red cell, and macrocytic, the large size red cells. At that time, there were no electronic cell counters. Now, these electronic cell counters today give you the indices of red cells in less than 45 seconds. As a result of which today, when we say microcytic, normocytic, or macrocytic, we are doing it on the basis of the MCV, which is less than 80, more than 100, or 80 to 100. And if you look at the types of anemia, the microcytic, the two commonest anemias are iron deficiency and thalassemia, especially in this country. And of course, the anemia of systemic disease. Macrocytic anemia could be megaloblastic anemia due to B12 and folic acid deficiency. And there are once again a host of conditions which can give you macrocytic anemia. And the normochromic normocytic anemia could be due to blood loss, hemolysis, and so on. Let's come to the iron deficiency. And why iron deficiency should be discussed so much? Because if you look at the anemic population, iron deficiency accounts for more than 65% of the patients. Iron deficiency is unavoidable. And this is an eye-opener. And this is a data from WHO just last year, 2021. What it tells you, that whether you are from the developed side of the world, belonging to US, Europe, Australia, or you are from the developing world, belonging to India, Pakistan, Bangladesh, Sri Lanka. Young children, 20 to 40%. Little grown-up children, 6 to 48%. Pregnant women, 20 to 52%. Women in the reproductive age because of the periods, 10 to 42%. And what's surprising, the men in the age group 15 to 60, 4 to 30%. And the seniors, 12 to 45%, have iron deficiency anemia. So if you look at the developing world, the figures are staggering. Every second or every third person, male or female, child or adult, young or elderly, have iron deficiency. What are the symptoms and signs of iron deficiency anemia? Did you realize that when you go to a dermatologist for the hair loss, maybe you actually should have come to a hematologist, because hair loss is a symptom of iron deficiency. Of course, when the hemoglobin is too low, you could have various kinds of cardiac symptoms, palpitations, and even chest pain. You can have headache. You may feel sleepy. And you may, in fact, sleep excessively. You may be depressed. And to the extent that you may even feel like committing suicide. And this is not taught at the undergraduate level, what iron deficiency can do to you. There is a specific symptom, because all the symptoms that I mentioned to you so far are non-specific. But there is one symptom which happens only when the anemia is due to iron deficiency, and that is pica. And what is pica? Pica is persistent and compulsive craving to eat non-food items. And this word pica comes from the Latin word for a bird, which is known for its indiscriminate appetite, as shown to you on the right side. Pica includes eating of mud, chewing on your hair, chewing on the ice cubes, or even chewing on your computer. It includes eating of dirt, clay, paint chips, plaster, chalk, cigarette ashes, soap, toothpaste, burnt match heads, cigarette butts, ice, glue, hair, buttons, paper, and scent. You name a substance, and if you've got iron deficiency, you may feel like putting that in the mouth. In fact, the husband comes home and finds the house is neat and clean. Be sure the housewife has got iron deficiency. There's a specific sign for iron deficiency, and that's spoon-shaped nail, koilonychia. They do not occur in any other disease except iron deficiency. And after 6 months of iron therapy, look at the nail, they become so beautiful. Iron deficiency has something very specific to do with the heart. As you are aware that iron is required not only for the formation of hemoglobin, but also myoglobin. And the heart muscle has myoglobin. The dysfunction of the heart due to iron deficiency can lead to cardiac impairment and cardiac failure. And cardiac failure can lead to decreased blood supply to the kidney, leading to renal failure. So anemia, leading to heart failure, leading to renal failure. And you may go to a cardiologist, you may go to a nephrologist, but the root cause was iron deficiency anemia. This is called cardiorenal anemia syndrome. That's a vicious cycle, which you can appreciate, that anemia leading to heart and kidney problem, the kidney leading to paucity of erythropoietin, aggravating the anemia, leading to further cardiac failure, further renal failure, and so on. Let's come to the lab. How do you diagnose iron deficiency anemia? Your starting point is this cartoon. What it shows you? Small red cells as against the normal sized red cell. So under the microscope, you can appreciate that these cells are small, microcytic. And that's the real picture. Under my own microscope, you can look how empty the cells look. The red cells are hypochromic and they're microcytic. Such small cells, the pessary-like cells, are seen basically in iron deficiency, though there are other causes of microcytic hypochromic anemia. And you often see what is called pencil cells. Moving on from the morphology, there are two specific lab tests for the iron deficiency. One of them is to estimate serum iron. Serum iron is not a specific test for iron deficiency because serum iron can be low even when you do not have iron deficiency. For example, anemia of rheumatoid arthritis, anemia of cancer, anemia of TB, anemia of various systemic diseases, infection, inflammations. So if serum iron is low, it does not mean you've got iron deficiency. With that goes what is called total iron binding capacity, which is a measure of transferrin. Total iron binding capacity goes up in iron deficiency. And this is a very, 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 very specific test of iron deficiency.